what's some information about the post that Dr. Nesbitt can say?
Oh my gosh. It's.
I mean, you remember it.
It's a.
Good afternoon. Hello. Woohoo. I am Dr. Nesbitt. Thank you. Good afternoon, everyone. I am Dr. Shauna Nesbitt. I am your Vice President and Chief Institutional Opportunity Officer, and it's my true honor to welcome you today to our celebration of Disabilities Month, and really have a fantastic presentation for you today with some very, very interesting presenters who will share with you some of the wonderful things that they are doing both on our campus and also in the community. It is the second celebration that we have had on our campus, last year being the first, and we really try to highlight new things that we are doing and new things that we find out about in the community that really celebrate the expanse of wonderful things that people bring to our community, both in and outside of UT Southwestern. I am truly honored to bring one of our own to speak. Dr. Kim is one of our department chairs, and she is here and she's going to speak with us a little bit about some of the work that she does. Before I start, I want to just recognize some of our leaders who are here with us today. Dr. Jeremy Falke, who is our Vice President of HR. I know I gave you a new title. Natalie Romello, who is our VP of Institutional Compliance. She keeps us in line. Travis Gill, who is our AVP of Access and Title IX. Jenny Doran, I don't see Jenny, but Jenny's here in spirit. She is our VP of Communications, Marketing, and Public Affairs, and Amanda Billings, who is our Vice President of Development and Alumni, and she keeps us funded to do great things in our community. Dr. Kim comes to us from our Department of Physical Medicine and Rehabilitation. She holds the Kimberly Clark Distinguished Chair in Mobility Research at the University of Texas Southwestern. She joined us in May of 2022. She's internationally recognized as a leader in pediatric rehabilitation medicine. She's board certified in the US and South Korea and with subspecialty certifications in brain injury medicine as well. She earned her medical degree from the Irwa Women's University in Seoul, Korea, and residency at the Rehab University in Rehabilitation Medicine at Yonsei. She came to the United States, was at New Jersey Medical Center, and before joining us as vice chair of PM&R, she was at the Columbia University in New York. She has about 5 pages of things that she has done that are absolutely phenomenal, but rather than hear me talk, I'd like to let you hear her talk. Dr. Kim.
Thank you. Okay. This was my dream, to be on the stage all the time. My name is Haekyung Kim. I'm a PM&R department chair, and I'm pediatric physiatrist. And this is such an honor for me to attend or participate this celebrating the 35th anniversary of the Americans with Disabilities Act, and which is the milestone of our nation's commitment to equity and inclusion. So I'm very honored to be here, and moreover, as a PMNR docs, even though we deal with the disabilities, we always out of disabilities because nobody knows what is PMNR many times. So this is my opportunity to introduce PMNR to our colleagues and students. So American Disability Act passed in 1990s, as you guys all may not know, but it was by President George Bush at that time. It really opens door to our patients for employment or access to public space and education. So before ADA, you can see I go to many different countries to do missionary work. There's not much for them to do, which means they cannot move around, they cannot get on the car, they cannot push their wheelchair. But our country is very different now because of ADA. ADA is a promise to do better. That's what we have here. So I was telling people that I'm a doctor, but I am also have a significant disability with the language and my English. So when I came to States, I really realized that disability is not simply physical disability we are talking about, right? My language barrier made me very depressed, and I started to have a severe migraine because I was very active trainee or student. And I went to medical school to be a rehab doctor. And when I came to the States, I cannot speak English, so I cannot help my patient. It really made me see the disability in different aspects. What is disability really? It's very individualized, personalized. So I was thinking about how many people with a disability in this country. And so this is 2022 data. So we have about 70 million adults has disability, some sort of disability. In Texas, we have about 3.55 million adults has disability. And then student, in between 2021 to 22, there are 7.3 million public school students attended special education. So we cannot just ignore disabilities. And disability also, I didn't want to talk about the cost, but disability brings healthcare costs so high, more than billions dollars we are using for disability at this time. So when we take a look at Texas, the disability in Texas is more, as you can imagine, mobility, cognition, so from the accident or they're born with that problem, but that comes with other stuff, mental health issues. I'm happy to have my psychiatric colleague here today, but it brings a lot of depression, metabolic disorders like high blood pressure, diabetes, by not moving around. So that also brings a lot of different issues in the community. So here comes PMNR. Physical medicine rehabilitation was not existing in the past. So in 1929, physical medicine started in Temple University in Philadelphia. And then around World War II, 1945, rehabilitation medicine started. So American Medical Association recognized the PMNR as one specialty in medicine. So our department started in 1945. It's very new medicine, and we are the doctor for function. So I was telling my trainees and students that PMNR is not only taking care of a diagnosis or disease, but we also take care of function and quality of life. So we complete the patient care, not simply treating the patient, but we complete their function. Therefore, PMNR is essential for the healthcare at this time. And then we approach patient holistic way, right? We don't see only eyes, we don't see only heart. We see them as a whole. That is what PMNR. And PMNR work aligns with the ADA's mission because we work for function, inclusion, and independence. So I'd like to introduce my department at UT Southwestern. Maybe some people may not know we have a physical medicine rehabilitation department at UT Southwestern, but it's very long history we have, 70 years old, just like me. We are ready to go to nursing home, or we have to rehabilitate ourselves, right? So we had about 6 previous chairs and 3 acting chairs. We have one of the largest residency program. We graduated about 300 trainees, and we have 2 model systems. So we are well-equipped department, and we are essential for UT Southwestern and Dallas and Texas. So PMR, what is going on PMR at UT Southwestern? We have a inpatient consultation service where we go to the Clements University Hospital where we're heavily involving the patient care, not for the inpatient transfers, but we treat the medical problem from Clements Hospital if they need further management, and we bring them to our inpatient. So we were able to help acute medical team to decrease the length of stay in the acute hospital at Clements, and we also bring the patient to provide the continuum of care. That's what we do. Main patients are trauma cases or transplant patient. In the outpatient clinic, we have more than 8 different subspecialty, so you can name it, we have everything. If you have back pain, neck pain, call me. I'll connect you to my colleague. If you have a depression, call me. I'll connect you to my psychiatry colleague. So this is our inpatient. We have 2 different floor inpatient gym. You can see therapists are showing, we call that 0Z. You cannot walk after the spinal cord injuries. You cannot walk because of a stroke. You can hanging in there and you can walk around. We work on the motor planning problems, so you can see all the fancy stuff, and we have robotics, rehabilitation technology we are bringing at this time. We have a lot of different type of modality we provide. So actually, PMNI is doing a lot of procedures. One of the typical procedure what we offer is spasticity management. If your family member has a stroke, they must become very weak but very stiff. So we do botulinum toxin injections. The famous is Botox from States. We have all different type of botulinum toxin we use, but you always want to be your doctor because I use Botox all the time. So come to me anytime. That's my retirement plan. When I retire, I'm going to go to your face. And then intrathecal baclofen pump, if someone has very severe spasticity, we implant the pump, we manage the pump, and we do cryoneurolysis. We drop the minus 82 degrees of ice to the close to the nerve, paralyze the nerve, and relax the muscle. We do a lot, and then our pain doctors do a lot of spine procedures. And sports MSK doctors does a lot of joint problem, and your grandmother, your mother can come to my department anytime. So PMNR across the lifespan. I like to introduce what we do is we start from, as a pediatrician, I start from the children's, from the NICU to the community. I do lifespan care. So that's another very unique. If you Google UT Southwestern PMNR, the #1 is, I would say I brand myself. I opened the adult cerebral palsy clinic, which is very few in this country. We are leading this program in Dallas. So you can see that, and our pediatric physiatrist is taking care of patients. I took over those cases, we continue the care with my team, and we also focus on cancer rehab, and we focus on MSK service line pain. Our department is mainly pain department. Pain causes functional problems. So you guys can see those things. So advocacy, when it comes to, as I said, PMNI is all about function, but we are advocating our patients. So we go to community, we work with them, we do research together with the community, and we provide the transitioning program. Another one, what we do annually with the Brain Institute, we provide adaptive sports expo every year. So this is this year we're going to do again in October 11th, 10 to 3 p.m. at Arlington Mavericks station. But please join us. Every year we have more than 400 participants coming, as you see, wheelchair dancing with all kinds of game. So we work very closely with the community. So future direction. PMNR, when you think about the physical medicine and rehabilitation, you think about PT, OT, speech only therapy part. But we are providing evidence-based practice, not only stretching, strengthening exercise, working together with our therapist colleague, we try to provide evidence-based practice, and we try to bring the rehabilitation technology. We work a lot with the UT Dallas engineering department, with our biomedical department to come up with robotics, any type of implantation. We are working on the vagus nerve implantation for the spinal cord injury patient. We also work with engineers on developing the robotics to support their movement, and so we want to advance those fields, and we also try to provide the care for the unmet needs of patients. That's a significant problem in the healthcare system. So if you know Ehlers-Danlos syndrome, the patients are very loose, they don't know what to do, they have a lot of pain problems, pelvic floor after delivery, they have significant pain and depression. Those things are all coming to our department. And then we also want to cover all the patients. So we try to have innovative virtual clinic. So we are working on the telehealth. We are doing it, but we want to more approach it strategically. So we can cover all patients in Dallas. Now we have a patient coming from other adjacent state. So we want to provide a comprehensive service for the patient who are far from us. And we will try to enhance, actually, this is very important, by enhancing faculty development to strengthen disability competent care, because we have to know the disability. In medical school, we don't teach disability. We don't have any curriculum in medical school at this time. We volunteer to teach what is disability in medical school. So that's what we are working with Dr. Huang at this time. And we are of course, we want to deliver the comprehensive team-based rehabilitation care. So continuing ADA legacy, ADA opened the door for us. They provide access, opportunity, equity, inclusion. So it's very important. And PMNR ensure people can walk through it. And at UT Southwestern, within just 3 conditions, we restore lives. So every day in PMNR, we help realize the spirit of ADA. And thank you very much.
That was amazing, right? You learn something every day of things that are happening right here under our noses that we don't always know all of the things that we actually offer for patients. So thank you, Dr. Kim, for sharing with us what we have here to offer. Our second speaker is one of our basic scientists. Dr. Chahrour is an associate professor in our Center for Human Growth and Development and the Department of Neuroscience and Psychiatry. Her work focuses on autism. She will discuss with us some of her work, as well as help us mere mortals to understand some of the more complicated concepts that she's studying every day. To Dr. Chahrour.
All right. Hello, everyone, and thank you for the kind introduction and for the invitation to speak today. It's an honor to join you as we celebrate the 35th anniversary of the Americans with Disabilities Act and the possibilities that it continues to unlock. I'm a neurogeneticist, and I study how our genes influence the brain, specifically in the context of autism. And today, I'll share with you how science, especially genetics, can help shape a future where our neurodiverse communities are more included, and how genetic discoveries are opening new opportunities for a world where every mind is valued. As Dr. Kim gave a very nice and overview of the ADA, I just want to spend 1 minute to highlight how ADA is this comprehensive civil rights law that marked a turning point in disability rights, breaking down barriers in education, public life, and employment. And for 35 years, it has advanced inclusion and accessibility, laying a strong foundation for both social and scientific progress. And as we look ahead, the ADA's spirit of opportunity and equity continues to inspire how we approach neurodiversity in science and society. Today, I want to focus on the less visible disabilities, but as Dr. Kim mentioned, all disabilities can also be invisible or less visible. And I want to talk about autism and related neurodevelopmental conditions and discuss how science, particularly genetics, can further empower our neurodiverse communities. So what is neurodiversity? Neurodiversity is this idea that differences in how our brains work are natural and valuable forms of human diversity. And these differences include how our brains function, how they process information and interact with the world around us in conditions like autism, ADHD, dyslexia, among others. And this framework moves us away from thinking about disorders and instead recognizes a spectrum of strengths and challenges. When we embrace neurodiversity, we see the value in all kinds of minds, and not just those that fit a narrow definition of normal. In other words, there's no one right way of thinking, learning, or behaving. And differences are not viewed as deficits, but rather as enriching our diversity. Autism is a spectrum of neurodevelopmental conditions that is characterized by differences in social interaction, communication, and behavior. And currently, about 3.2% of children are diagnosed with autism, with more males affected than females. And the prevalence has been rising steadily at about 7% annually for the past 20 years. In addition to the core symptoms of autism that I mentioned, individuals often experience a range of co-occurring behavioral, psychiatric, developmental, and medical conditions. And the numbers you see here show the proportion of individuals with autism who also have these co-occurring conditions. These can include intellectual disability, epilepsy, difficulty sleeping, and so on. Each of these associated conditions can also vary in severity. So together, they reflect this broad spectrum of behaviors and traits that are seen in autism. And I'm sure a lot of you have heard this famous saying that if you've met one person with autism, you've only met one person with autism. And that's because they're truly unique in their experiences, strengths, and challenges. And this diversity is reflected in the lives of individuals on the spectrum, from writers and scientists to chess grandmasters. Many have leveraged their unique ways of thinking to achieve remarkable things in their fields. And at the same time, there are individuals with profound autism who may be minimally verbal, have co-occurring intellectual disabilities, or experience more severe challenges like epilepsy or even difficulty walking, as in this example. Many require lifelong support, and their voices are often underrepresented in the public conversation about autism. So it's critical for us to recognize and honor the full diversity of autistic experiences. I told you that autism is incredibly diverse in how it presents clinically, but what causes autism? We know from decades of research, especially in very large twin studies, that autism is highly heritable. In fact, up to 90% of the risk can be attributed to genetic factors. But there are also environmental influences, for example, prenatal exposures or complications during pregnancy that can also increase risk and play a role, often interacting with these genetic predispositions. In other words, autism doesn't have a single cause, and it rather arises from this complex interplay between genetic and environmental factors. So before I tell you about autism genetics specifically, I just want to take a quick step back and talk briefly about what human genetics tries to answer more broadly. At its core, human genetics is the study of how traits are passed down from parents to their children. And basically, we explore how variation in our DNA sequences, those tiny changes in the DNA sequence, can relate to traits that we see in individuals, whether these traits are physical, cognitive, or behavioral. And human genetics seeks to answer this fundamental question about who we are and what makes us that way. And by understanding the genetic basis of human health and disease, we can move towards earlier prediction, better and more accurate diagnoses and earlier diagnoses, as well as personalized and targeted treatments. So over the past 2 decades, research has identified hundreds of autism genes, and some are linked to very well-defined rare syndromes, such as Fragile X or Rett syndrome, and another proportion of cases are due to chromosomal changes, or what we call copy number variants, and these are big deletions or duplications in the DNA sequence. And then another proportion of cases are due to either spontaneous, we call those de novo, or inherited variants. And in this case, it's just a single change a single letter in the genetic code. And then finally, some cases are due to somatic variants. And these are DNA changes that only occur in the brain. But for many cases, the underlying genetic causes have not yet been identified. And basically, so far, genetics reveals that autism is not a single category, but rather a spectrum reflecting the diversity of human behaviors and traits. So while hundreds of genes have been identified, each of these genes on its own only accounts for a tiny proportion of cases, in fact, less than 2%. And autism and other neurodiverse traits arise from this complex mix of many genes, but each of them individually contributing to a small proportion of individuals. We have much to learn yet, and that's what makes our ongoing research so essential. My lab here at UT Southwestern focuses on identifying autism genes, studying their function in the brain, and uncovering the underlying molecular mechanisms that they regulate. We use complementary genomic approaches and model systems to study how specific genetic variants affect brain function and behavior. And ultimately, our goal is to use this knowledge to improve diagnostics and to design targeted therapies. So how do we actually do this? We identify autism genes through something called whole exome or genome sequencing. That's basically, think of it as reading the entire genetic code of a person. And we do this in collaboration with families with autism. We partner closely with our community and our clinical colleagues here at UT Southwestern and other institutions. And our studies include participants across the broad spectrum of autism. So far to date, we've enrolled over 3,000 individuals in these studies. And our aim is to inform diagnostics and therapeutics by finding these specific autism variants and the genes in which they occur. But also, while we do that, we're learning about social behavior, about how the brain develops and functions, about how language is formed. So in addition to the autism genetics study that I just told you about, we're also investigating several autism genes to study their function in more depth in the brain. And we want to find the specific mechanisms, as I mentioned, that they regulate and how these mechanisms are impacted in autism. So here I have 2 specific examples of these types of studies that we're doing, focused on 2 genes, UBE3B and KDM5A. Individuals who have these UBE3B mutations or variants that affect the gene itself have profound autism with intellectual disability and complete lack of speech. And they also have other challenges. Our studies into the function of this gene found that basically when neurons lose UBE3B, they don't develop as they should. As you can see here in this image, one says neurons with UBE3B and the other is without UBE3B. And you can kind of tell by looking at it that the neuron is less developed, it's less complex, it has less branches. And we also found that UBE3B regulates a critical metabolic pathway in the brain. And now we're looking into that more closely to see if we can repurpose any specific players in that pathway to try to see how we can modulate the pathway. And then my other example right there is the gene called KDM5A. And similarly, individuals who have mutations in KDM5A have profound autism. And our studies in this particular case found that neurons that lose KDM5A actually develop faster. And I think the image is pretty clear in the neurons that have KDM5A have a lot more branching and complexity. And we also found that, interestingly, KDM5A regulates hundreds of other genes as well. So it basically is required to turn on and off a big program of other genes at specific exact moments during development. So these are just two examples of the types of studies that we're doing. And I just want to move now to just really highlight how our advances in genetics are transforming our understanding of autism, and how these insights are not just academic, but they're actually enabling earlier, more accurate diagnoses, opening the door to personalized supports. And also, science helps reframe neurodiversity as a natural part of who we are and how we behave. And this reduces the stigma. And of course, this comes with the responsibility to make sure that the research benefits everyone who needs it. I am going to spend very brief moments on each of these 4 points. So first, in terms of genetic testing, it can identify neurodevelopmental differences early, even before any behavioral signs appear. And we can do this because once we have a full catalog of all of the genes that contribute to autism, then we're able to inform these genetic tests. And this ends what's called the diagnostic odyssey, or years of uncertainty for many families. And as I mentioned, we work with a lot of families whose children have profound autism with other challenges. And when we enable this earlier access to therapies and educational supports, it provides more clarity and direction for the families and also for the clinicians who are supporting the families. This means that their interventions can begin sooner, ultimately improving outcomes and quality of life. So in addition to genetic testing, another way how advances in genetics is contributing to our understanding is when you know and understand each person's unique genetic makeup, then you can tailor specific interventions, whether they're therapies, educational supports, or medical treatments to what really works best for them. And this is the promise of precision medicine for neurodiverse communities. It's basically moving away from one size fits all to specifically what works for you. And then when science shows that neurodiversity is part of natural human variation, it challenges stigma and stereotypes. And how we talk about neurodiversity shapes how our society responds. Acceptance grows when we value all minds and we recognize that strengths come with difference. And of course, as I mentioned, with these advances come ethical considerations and responsibilities. That's why the best science truly happens in partnership with neurodiverse individuals and advocacy groups, to make sure that the research is inclusive, equitable, and also respectful of the neurodiverse identity. And so in looking forward, I think the future is shaped not just by science, but also by advocacy, policy, and the voices of those with the lived experience. And I want to just stress how genetics and research in general are tools for understanding and not exclusion. And so as we celebrate the ADA's legacy today, let's remember that progress is possible when we all work together to shape a future where every mind belongs and every possibility is within reach. And we hope that our research here at UT Southwestern continues to, into the genetics specifically and mechanisms of autism, continues to drive progress into diagnosis and personalized support for individuals with autism and their families. And in closing, I want to thank all of you for your attention, for your advocacy, and for your commitment to inclusion, and to thank the individuals with autism and their families for participating in our studies and truly driving our research. And I also want to thank the foundations and family support groups and my fantastic team and our collaborators. And finally, I'm happy to chit-chat with you after the event as we check out the wonderful art. So thank you.
Oh, thank you. Yes. Great. And our third speaker, Hunter Folsom Lacey, is the executive director of the Creation Studio, an art studio and gallery for adults with disabilities. She received her BA in psychology from Pepperdine University and her master's in new media photojournalism from George Washington University. Her graduate thesis looked at the positive impact of employment for adults with disabilities. Prior to the Creation Studio work, she worked as a photojournalist and a teacher, and her brother Chase, who has congenital encephalopathy, inspired her to marry her love for art with disabilities community to open the Creation Studio. Now, a personal story. I have known Hunter and Annabelle and her mom and dad for 20 years, and we were at dinner a couple of weeks ago and just talking about what Hunter is doing, and her mom said, oh, she's got this Creation Studio that honors people with disabilities. And I said, I would love to have her for my program. And she said, well, she's doing something at UT Southwestern. I was like, oh my God, that's my program. So there you go. This is the honor, a great team who finds fabulous people and a great family, and they are all here to share and support and talk about the wonderful work that they do. Hunter.
Hello. As Shauna said, or Dr. Nesbitt, my name is Hunter Lacey, and I'm the founder of Creation Studio. And my sister Annabelle is here, and she's our art teacher. And this is our brother Chase. That's me and Chase many years ago, and that's me and Chase last summer. Chase was born when I was 2, and shortly after he was born, my parents started to notice that he was missing milestones, and so they saw many doctors over the years, and eventually he was diagnosed with congenital encephalopathy, but it was definitely a road to get there, to get to that point. And through that, my parents were also navigating, trying to figure out where Chase was going to go to school. And as he got older, it became more apparent that he had profound autism in addition to his congenital encephalopathy, and that he needed a lot more than the schools that they had looked at were offering. And so my parents actually started a school for kids with disabilities that's still around today. It's called Chase's Place. And I grew up going there all the time. I grew up going to Chase's therapy appointments with my mom, and I always just felt really at home in the disability community, but I never really thought that it would go beyond the personal for me. I didn't know what I wanted to do when I was in college, but I knew I was interested in people, and so I studied psychology. But when I graduated, I knew I don't think I can do counseling. It just doesn't seem right for me. But I always loved photography. And so I started working as a photojournalist pretty quickly after college, and that led to going to grad school. And when I was in grad school, it just kept coming back to people with disabilities. I loved spending time with them mostly, but it was also, I was interested in how employment can empower them and change their lives and change the lives of people around them. And so I went to part of my grad program in DC, but then I moved back to Dallas for my thesis project, which was a year long. And I followed one man named Max, who has worked at a church for around like 25 years. And I did a photo series following several different adults with disabilities at their jobs. And I did an article just kind of explaining everything and interviewing each of them and talking to experts in the field. But because of my brother, and my parents, I had all of these connections with the disability community. So Dallas was a great place for me to do my thesis project because otherwise I really wouldn't have known where to start. So that was a big driving force in coming back here to do that. And I knew Hugs Cafe, which is catering today, and Hugs Greenhouse, and that is where this photo was taken. This is at Hugs Greenhouse, one of their employees. And then on either side of in the photos, on either side is to Hugs, well, one is a Hugs Cafe employee, Jerry on the far right, and then Serena is a Hugs Greenhouse employee, and then in the middle is Kristen, and she works at a preschool. But I just loved spending this whole year doing this project. It was so fulfilling for me, and I woke up every day excited, and it just felt right. But I still wasn't sure how I was gonna tie in my love for spending time in the disability community with my skill set. But I went on to teach. So I taught journalism for a couple of years. And in that time, one of my coworkers told me about Creative Growth, which is the first art studio for adults with disabilities and gallery that opened in Oakland in the 70s when a lot of people were deinstitutionalized for the first time. And I was just blown away by the story. He showed me this video, and I just couldn't believe it was kind of all of the things that I love the most brought together. And, you know, being a photographer, I don't have much skill set in drawing and painting, but just being in that world, I love art so much, and I love spending time around artists and seeing artwork. And I love spending time with people with disabilities. So it was like, I wonder if there's one here in Dallas. I hope so. I want to work there. But there wasn't one. So I sort of just went back to normal life, but started kind of brainstorming. Could I possibly start this? Could Annabelle be our art teacher? Is this possible? And through lots of time and fundraising, we were able to start that. But first, before I go into that, I just want to talk about Judith Scott a little bit. She was really a huge inspiration for me, and she's now passed away. She was born in the 40s, but you can see her with her twin sister. She had Down syndrome and undiagnosed deafness, and the reason her deafness was undiagnosed is because she was institutionalized at a young age, and back then, care for people with disabilities was not great, and so nobody took the time to realize why she wasn't speaking, wasn't communicating, wasn't understanding. And so she could have had way more communication abilities if there had been intervention sooner, but her sister, after Judith had spent probably, I think, around 40 years in institution settings, she took on guardianship of her and moved her in with her. Eventually, she moved to a group home, but they started going to Creative Growth in Oakland. And Judith took a fiber arts class, and she, after like the first couple of years she was there, she wasn't really making art, but she took this fiber arts class, and she started making these sculptures that people were just amazed by. And she was really prolific. She was, every day would go in and just make tons and tons of these beautiful sculptures, and her art, when she was still alive and still today, has been exhibited all over the world. It sells for tens of thousands, hundreds of thousands of dollars. It's pretty incredible. But she's not the only example of artists at Creative Growth and other studios that have opened since who have accomplished this. And I was so moved by her story, but it also made sense to me. I think I have always respected people with disabilities because they're able to approach things in such a different way. They're neurodiverse, as we were talking about. And I think that they're just able to access different parts of themselves that someone who's neurotypical may not be able to. And so, of course, it makes sense to me that they can be so creative. And this is a photo of Creative Growth back when they first got started. And I love this quote I wanted to share with y'all, I think, and it ties into with what I was looking at with my thesis project, which is that it's a ripple effect. Not only is allowing these artists to have a chance to make art in a community setting, to show their art, to sell their art, that it's empowering for them, but it also is empowering for their families and for their friends and the people that they may be interacting with them for the first time. And that's what I really saw a lot in my thesis project, was that people who have never met anyone with disabilities were meeting people with disabilities for the first time, because they were working, in a restaurant, in a greenhouse, in a preschool, wherever it might have been. And the same has been for our artists. I've seen people coming into the gallery, meeting our artists, our art show that we had. It's just a really great way to all be together in this community. So this is my sister Annabelle. She didn't know I was including this photo. That's her with the mural she painted for my daughter. And this is some of her artwork. She is a really talented painter and drawer, and when I was coming up with wanting to do this, I was like, Annabelle, you'd be perfect for this. It'd be so great. We'd be a great team. And, she wasn't sure at first, just because she didn't know what she wanted to do next, but after a little bit of time, she was like, yes, I'm coming to work at Creation Studio. And she's just been so amazing with our artists. She is able to share her knowledge and skills with them in a way that I never could. I truly couldn't do it without her. She, even just down to like supplies knowledge, there's so many things that I have no idea what to give them or what to use, and she's got it down. But before we got started, so about a year ago was when I was putting things together, but we didn't open until January of this past year. And so in the fall, when we were, I was definitely moving forward with this. I was fundraising. Annabelle and I wanted to find ways to reach out to the community and find artists. And so we did some group art classes at Belong Ministry, which is through Highland Park United Methodist Church. And that was great. It was really fun. Everyone enjoyed it a lot. We were able to spread the word a bit. And the artists really made some interesting artwork. But our real first two artists who are here today, and another one of our artists is here as well, were Reese and Happy. Reese is someone I've actually known since I was a kid, but we don't remember meeting because we met in waiting rooms of therapy, like OT appointments, that kind of thing, because my brother was there and Reese was there. And so I've known Reese for a long time, but I've gotten to know him really well since he's become one of our artists. And then Happy is also here. I got connected to through a friend of mine, but Reese and Happy knew each other before all of this too. And when we first opened, we had Reese and Happy signed up, but we still were looking for more artists, so we hosted some more group classes, but this time in our own space, we're at the Village Apartments in East Dallas, and we're in one of their showrooms. And so we've had the Autism Treatment Center come and Connecting Point. We did some classes for them. They made really interesting stuff. It was so cool to finally, in January when we opened, to see this happening in our space and to see it happening in real time, because I had really just dreamt about it and seen articles about it online and looked at the websites of other studios who do this, but to actually see it happening in real time was just so special. And since then, lots of really interesting artwork has been made. We have 6 artists. This is a piece by Daniel Simmons. This is by Happy Waterman. This is by Reese Gold. This is Lisa White, Rachel Frederick, Emily Morrow, and Alec McKelvey, who's here as well. And this is from our art show in April. It was a great turnout. We, invited everyone that had been following us, and then our artists invited people that had been following them and people they were friends with. And so lots of people came. It was really amazing. It was honestly an easy event to host and set up because all I had to do was just be there, and people just came and looked at all the beautiful art that all of our artists had made. But yeah, just in closing, I think it's been really special to have this art studio and gallery where we can sell beautiful art that these really talented artists have made and give them the space to do that. But I think the best part has been the community, and I think that's a really important part of why these spaces should exist, is that these artists are being given an opportunity to come together, have time in a space with like-minded people who are chasing after the same goal of being a working artist, and having me and my sister there to support them along the way. So it's been really wonderful, and we have art up here, and then we have some art out in the hallway, and we have some business cards out in the hallway as well. So we have art for sale, so not here, but on our website. So that's all, and thank you so much. I appreciate being asked to do this. Thank you.
Thank you so much. Thank you.
Oh, thank you. Thank you.
Great. Thank you so much, Hunter, and to the Folsom family for joining us, and Lacey family. This is fantastic. Don't forget, we have some stickers and some cards outside, and the artwork that you can take a look at so that you know where the art gallery is. Thank you to the Hugs Cafe, who has provided our food for today. You may have seen a few of the folks from the Hugs Cafe delivering the food. They were really all involved in getting this together for us today. Our BRG group, the disabilities group, Sonny Hoots, wave your hand, Sonny, and the group here, there are several members here. We thank you so much for the work that you do on our campus, the spirit that you embody, and the topics that you bring to our attention that you'd like to discuss and bring to the rest of our campus. We appreciate all of you for coming to join us today. Please have a fabulous afternoon. Take a look at the artwork and celebrate the American Disabilities Act celebration. Thank you. And take a moment to complete our survey. Thank you.